definitely kind of interface between the dental community when we're dealing with sort of the dental issues like the toothaches or the broken teeth or the impacted wisdom teeth, or the missing teeth with dental implants, but also the medical stuff that affect the jaws, like fractures and tumors and developmental issues.
Welcome to another show of Doc Talk Live Season 7. I just want to thank our listeners for tuning in today. And as you all know, Doc Talk Live is a health show dedicated to educating its listeners about different health topics every week. We do so by bringing on medical experts to answer commonly asked questions. So be sure to send in your questions through Facebook Live every Wednesday at 5 p.m. And you can get more information on the show on our Facebook page, Instagram, Twitter, YouTube, as well as our website, doctalklive.com. That's DOCTALK live.com. Also, watch more episodes of the show on our platforms such as Spotify, iTunes, iHeartRadio, whichever podcast platform you like to listen to. Again, my name is Dr. Samir Nagia. I'm excited to be here for this great show we have for you. And joining us in the studio is Dr. Tamir Anver and Dr. Aaron Vickers, who are here to educate us on oral surgery. And most of us who are listening have at some point had some kind of tooth pain or discomfort. And so if you have and you're interested to learn more, this is a great show for you. And Dr. Anver and Dr. Vickers will go over the various causes of tooth pain and dive in a little bit more on specific causes of tooth pain. So Dr. Anver and Dr. Vickers, welcome to the show. Thank you for volunteering your time. I know you both are extremely busy surgeons. We're excited to have you both in studio, and I'm excited about diving in on today's topic. But before we do so, how about you tell our listeners a little bit about yourselves and where you practice? Dr. Vickers, you want to go first?
Yeah, great. My name's Aaron Vickers. I am an oral surgeon, and I have practices in Flower Mound and Denton. And I've been here in the community for around 7.5 years now. Love taking care of people, love what we do.
Awesome. And Dr. Anver?
And I'm Tamir Anver. I want to thank you guys for inviting us onto the show. We're excited to answer some questions about oral surgery. I was born in D.C. but grew up in Texas, and the DFW area has always been home for me. So after I was done with my training, I was excited to come back here and work with Dr. Vickers, and we're both actually settled in Flower Mound with our families. We both have kids, and we're excited to take care of the community.
Well, we're really excited to have you guys here because in the 7 years of Doc Talk Live, it's very infrequent that we get to hear about teeth, and it's very important for everyone listening. And so we're very happy that you guys are here to share your knowledge and educate all of us, including myself, who, being a physician, I don't know a whole lot about it. So I'm excited to learn as well along with our listeners. So maybe before we jump in, what exactly do oral surgeons do? When would we, as a patient, see one?
I think that's a really great question. Oral surgery is kind of that like missing link between dentistry and medicine. And so a lot of people are kind of unclear about what do oral surgeons do. In our practice, we do everything from taking out difficult teeth to replacing teeth with dental implants to IV sedation and anesthesia to the treatment of facial trauma and cysts and tumors of the jaws and face, all the way to corrective jaw surgery for alignment issues and growth and development issues of the jaws. And so it's a really broad scoped specialty, and it's a really unique specialty because we definitely kind of interface between the dental community when we're dealing with sort of the dental issues like the toothaches or the broken teeth or the impacted wisdom teeth, or the missing teeth with dental implants, but also the medical stuff that affect the jaws like fractures and tumors and developmental issues.
So Dr. Vickers mentioned about your guys' practice. Can you tell us a little bit about the practice and where would a patient see you, in a hospital setting or a clinic, to do these surgeries?
So our practice is primarily based out of Flower Mound, Texas, and we have another location in Denton as well. Most of what Dr. Vickers and I do is done in the office, but we're also credentialed at a couple of hospitals in the area. So some of the bigger surgeries, like the corrective jaw surgeries or trauma, some of the pathology types of cases, we do more in the hospital setting.
Great. And what are like the top 5 things that you probably see on a routine basis?
So I'll take that one. I would say the most common procedure in an oral surgeon's office is the removal of impacted wisdom teeth. I think a lot of people can relate to having gone through that or experienced that. That's probably our number one most common procedure. The second most common thing we do would be removal of diseased teeth that need to be removed, and then replacing those teeth with dental implants. Those are definitely sort of our bread and butter surgical procedures. And then we're kind of unique as oral surgeons in that we receive very specialized anesthesia training. And so the provision of in-office anesthesia services while we do the surgery is kind of a very unique part of our specialty as well. And so we see a lot of patients who have a lot of fear. And sometimes that is the reason for the condition that they're in, and so we're able to provide advanced pain control and anesthesia in the office as well. So it's I would say those are kind of the bread and butter things that we take care of the most.
And that goes along with what he said at the beginning. So as oral surgeons, we go to dental school first, and then we go to a residency, which is usually either 4 years or 6 years. Both Dr. Vickers and I completed a 6-year residency.
Oh, wow.
So that means that we went to medical school as well. So we both have a dental license and a medical license. And as a part of that training, we were exposed to all kinds of things. So all the stuff that he talked about, from the removal of teeth and dental implants, but also trauma and pathology, some cancer surgery, cleft lip and cleft palate stuff, cosmetic stuff. There's a ton of anesthesia. We get a significant amount of anesthesia training so that we're able to do that safely in our offices and keep everybody safe.
Well, that's an incredible amount of training that you guys been through. So wow. So a question that I often get asked about this is, can someone go directly to an oral surgeon, or do you have to be referred from your local dentist that you see?
That's a good one. That comes up a lot, so thanks for asking that one. You can come straight to an oral surgeon. Particularly if you know that you need or want oral surgery. There are definitely some times where we encounter patients who come to our practice, and then it turns out that they may not need my services. They may need the services of their regular dentist. Turns out their tooth can be saved. Turns out their tooth can be fixed. And in those cases, we get them plugged in with a dentist to take care of that need for them. But for the most part, if you're expecting that you need your teeth out or a tooth out or replacement of a tooth with a dental implant, for example, you don't have to come by referral. If you call our practice, our staff would get you set up for a consult, and we'd take it from there.
Great. So one of the things that I had to get done as a younger kid was get my wisdom teeth pulled. So my first question for you guys is, what are wisdom teeth, and when do you have to get them removed, or how do you know when you have to?
So wisdom teeth are the third molars, which are the teeth in the very back of the mouth. They usually come out or attempt to erupt sometime in the mid to late teenage type of years. And early on, some patients may not experience any issues with the wisdom teeth, but because of where they're located as far back in the mouth as they are, many times they're difficult to keep clean. They cause a lot of pain during the eruption process. And even if they don't come out entirely to where they're impacted, people have heard of impacted teeth, impacted wisdom teeth, sometimes they grow things like cysts and tumors and other things around them. And so we definitely recommend patients coming in to be seen for wisdom tooth removal, usually around the age of 15, 16, to get an evaluation, take a look at the x-ray, try to anticipate whether or not they're going to have sufficient room in order to allow them to come into place, and see whether or not they need removal.
I think that's a really good thing that you brought up, the word impaction, right? So like people are always like asking me, are my wisdom teeth impacted?
Right.
And they're scared that I'm going to say, yes, they are impacted. But in fact, impaction is very common. And so to kind of clarify what that means to have impacted wisdom teeth, basically an impacted tooth is a tooth that cannot erupt into the proper position. And in fact, any number of your teeth could be impacted. We see patients with impacted teeth that are not their wisdom teeth or their third molars as well. But the wisdom teeth are the most commonly impacted teeth. So an impacted tooth just means that the tooth hasn't erupted and it has a very low likelihood to erupt into a proper position. So it may mean that it's totally stuck in, down and deep into the jaw, or it may mean that it's just a little bit through the gums, but there's not enough room for it to fully erupt. And there are different levels of impaction or kind of classes of impaction. But wisdom teeth we find are commonly impacted primarily because of lack of space. And so, and my opinion is these days with many patients having orthodontic care where they get their teeth straightened out, most people start with some crowding in their teeth, and if you get all the crowding taken out, you see all the space was used up, right? So there's just limited space available in the back for those wisdom teeth to come in and be cleansable and be healthy and functional teeth.
Gotcha. Well, that was good because I never had that discussion when I got mine pulled out, so it was good.
They gotta go.
Yeah.
They just gotta go, and you do it.
Yeah.
It's good to understand why. So should you remove all the wisdom teeth when you get them removed, or?
So great question. I would say that most patients that we meet, particularly our younger patients, would benefit from the removal of their wisdom teeth. And generally, if we're going to be removing some of the wisdom teeth in those younger patients in particular, we want to remove all of them. And the risk-benefit kind of analysis changes as our patients get older, because as we get older, recovery from the procedure is more difficult, risks of the surgery itself are greater, the teeth are larger, sometimes they're in contact with important structures like nerves and sinuses and things like that. And so whether we take all of them or just one of them or two of them or whatever can change on a case-by-case basis. But in our younger patients, generally we favor removal of all of the wisdom teeth because, number one, they're going to heal more quickly as a young person, and they're going to have fewer complications when the treatment is done at a younger age. So we say, hey, let's just get them all taken care of, heal once, be done with it, don't worry about it when you're older. What do you think?
To that point, we still see several patients who early on at that age, for one reason or another, were not able to have their wisdom teeth removed. So we see some patients, in their 30s and 40s who come in, and now at that point, the recovery is a little bit harder. Now they have kids and jobs, and it's a little bit more difficult and more taxing on their life in order to go through an oral surgery procedure, and the recovery takes a little bit longer. And one of the examples that I like to give is a couple of months ago, I actually had a patient who had all 32 of his teeth, which is the total number of permanent teeth, and he was in his 70s, and he was ultimately happy that he was able to maintain his wisdom teeth until he started to develop Parkinson's. Oh, wow. And he couldn't keep his mouth as clean as he would like and couldn't brush in the back. So at his age in his 70s, he had to have all 4 of his wisdom teeth removed. And so when people ask us, why are you always taking out wisdom teeth, is because we see what happens many times when it isn't removed at an earlier age, or they aren't removed.
Well, that's a good point you made.
Yeah, I mean, sometimes we'll meet patients. A lot of times, maybe a parent that's bringing a teenage or college-age, person in to have an evaluation of their wisdom teeth, and they'll say, kind of as a point of pride, like, "I still have my wisdom teeth."
Hear it all the time.
And I usually say to them, "For now."
For now, exactly.
And hopefully it stays that way.
That's right.
So, changing gears a little bit,
Sure.
When I send a patient for a kidney biopsy, one of the first questions I get asked, which has nothing to do with the actual biopsy, is what type of anesthesia are they going to use? Mm-hmm. So, for you guys, like when you take the wisdom teeth out, what are the different anesthesia options? And I'm sure it's advanced since I've had surgery done on my teeth.
Dr. Amber?
Yeah, so the vast majority of our wisdom tooth patients undergo general anesthesia in the office, where they are, we start an IV and give them the medications for them to not only be relaxed but help take away their pain and essentially get them asleep where they're still breathing safely on their own. It makes the process a lot smoother and a lot easier on the patient, and it allows the surgery to be done more quickly and more efficiently, which leads to a quicker recovery and better outcomes for the patient as well. So the vast majority do that sedation in the office.
So it's not laughing gas anymore.
No.
Yeah, I mean, so there, it's a really great question because there are definitely multiple ways that the procedure can be done, and on a case-by-case basis, certain things would factor into how we choose to do it. The most basic way to do oral surgery and the way that it's done, honestly, in most of the world, is with just local anesthesia, right? Mm-hmm. So a patient just gets some numbing injections, and then they do the surgery. I had my wisdom teeth done that way when I was a trainee in oral surgery, because I put off my wisdom teeth, and I was having problems, and I didn't have any time to be sedated, so I just had one of my colleagues take them out after work one day.
Now you know better.
That wasn't super pleasant, so I tell my patients a lot of times that story because I have an appreciation for what it's like to go through impacted wisdom tooth removal with just local, and it's not terribly pleasant. And so, yeah, most of our patients do IV sedation, and one of the things that is kind of out there in the dental community as well is the concept of oral sedation. And in most oral surgery practices, certainly in our practice, oral sedation is something that we very rarely do. Mm-hmm. And the reason for that is because with oral medications, there's a great variability in how quickly they work and how long they last and to what effect they have on each individual. And IV medications vary in how they kind of affect each individual as well. But with IV medicines, we can do what we call titration, where we can give you a little bit of medicine, see how you feel. Some patients, I can give a very small dose of sedative medication and they go to sleep. The next patient, I might give that same very small dose and they might say, hey, I thought you were going to put me to sleep. Mm-hmm. And so because everybody can respond to the medications differently, IV sedation allows for really fine-tuning the control of the sedation. And that also gives us a higher safety profile as well, because some of the medications we use are reversible with IV medication, and they're very short acting. So that allows for us to keep the procedure safe for our patients as well.
I think he brought up a really great point with how in the majority of the world it is done under local anesthesia. And I'll have a parent or a grandparent who brings a patient in to talk about wisdom teeth and anesthesia, and they say, why do they need to go to sleep? I had mine out with just some numbing medicine. Mm-hmm. And so I'll always ask them, okay, tell me about it. They're like, oh yeah, that dentist, had the knee on my chest and they were pulling for 2.5 hours and they used this instrument. I'm like, so you're telling me 45 years ago you had an hour-long procedure and you remember every detail about it? And so I was like, that's not necessary anymore. Anesthesia in the right hands is very safe. It makes the process very streamlined for the patient and a lot easier to where they're not having to think about how much they don't like the dentist or how much discomfort they had. Many people do end up going through wisdom teeth, and for some people it's their first big experience in a dental office. So if it's not, in a sense, done in the smoothest way or in the most pain-free way possible, that sometimes can lead to some dental anxiety, some dental phobia, to where the patient doesn't feel good about going and getting routine cleaning because they had a bad experience, and that leads to worse other side effects and other outcomes because they're not taking care of their mouth, they may not be taking care of their health, and leads to tooth loss or stuff in the future. So we just try to keep that easier looking forward for the patient's health.
No, great point. Great point. So those who are just joining us, you're listening to Doc Talk Live. We're live in studios with Dr. Unver and Dr. Vickers, oral surgeons talking about various dental conditions. And it's been a great show so far. I've learned a lot about anesthesia, I've learned about wisdom teeth, and let's try to transition to a new topic here, which is very important, which is dental implants. Dr. Unver, do you want to tell us a little bit about what is a dental implant and what to do about that situation?
I would love to, but I know that Dr. Vickers is chomping at the bit to tell you.
All right, we'll let Dr. Vickers.
Okay.
I know he is.
Great, yeah. So dental implants, he's making this joke because it's kind of a passion of mine to help patients replace ailing and failing teeth with dental implants. But dental implants are essentially, at their most basic level, titanium screws that go into the jawbone and become the anchor for replacement of teeth. This anchor can be used for removable teeth to help hold them in place. Like if you have the loss of all of your teeth and you need dentures, for example, you can use dental implants with almost a snapping mechanism to keep the teeth in place, or they can be used for permanent teeth, either in the form of a single tooth replacement where the implant basically acts like a new root. So the implant goes into the jawbone where the tooth root used to be, and a new crown, the chewing part can go over top and attach to the implant for a permanent single tooth replacement. And then it can be used also for multiple tooth replacement by placing a few, 2 or more implants around the jaw. You can replace multiple teeth as well. And so dental implants, these days are definitely the go-to standard for tooth replacement because they allow patients to replace their teeth with something that will not be afflicted by the same things that caused their tooth loss in the first place.
So follow up on that. So who's the ideal candidate for an implant?
So to me, the ideal candidate for a dental implant is nearly anyone who's lost teeth. Now, obviously, we would never do dental implants for wisdom teeth because those teeth are not commonly needed for proper function. But for the other teeth, really any of the other teeth, if you are missing any of those other teeth, you may benefit from a dental implant.
Sure. And is it painful? I'm sure that's a question you get asked all the time.
That was actually going to be what I was going to bring up, because the idea of a titanium screw in the jaw sounds so overwhelming, like very Terminator-esque, and it's just not. So I would say, on average, it's probably the most painless procedure of all the things that we do in the office. It's when done correctly, everything is done through a very small incision, as minimally invasive as possible, and I would say maybe greater than 80 or 90% of the patients that I see with dental implants tell me that they're surprised how little it hurt at all. Maybe it's over-the-counter ibuprofen or Tylenol for the vast majority of patients. So no, the short answer to your question, it's not a painful procedure, aside from knowing that you've had a little bit of oral surgery done in your mouth.
So typically when patients ask, can I get it? You went over that. Does it hurt? Mm-hmm. And then the next question usually is, no matter what it is, how much does it cost? Is it covered?
Right.
Do the insurance plans cover these kind of things?
That's a great question. So, the interesting thing about being oral surgeons is that we have patients that need medical procedures where their medical insurance is involved in helping them pay for their procedure. And then we have patients that need dental procedures. And then there are procedures that could be considered dental or medical. And one of the things that's challenging for patients is to really navigate that whole process, right? As it pertains to dental implants, the majority of the time that will be considered a dental procedure. Rarely will medical insurance cover a dental implant. Almost never, but occasionally if it was needed for replacement of teeth due to loss for a tumor or something, trauma, sometimes they will intervene. So usually it's going to be a dental procedure going to dental insurance. These days, I would say the majority of dental insurance plans that we see in our practice do provide some coverage for dental implants, and the amount of coverage can vary from as low as maybe 30% to up to 100%, depending on your plan.
So we have a couple minutes left, and Dr. Unver, I want you to talk about TMJ. So briefly, can you tell our audience a little bit about what is TMJ or TMD, and how do you treat it?
So TMJ is an acronym for temporomandibular joint, which are the joints in front of your ears that the lower jawbone or the mandible hinges from. And so a lot of people have TMD, which is temporomandibular disorder, which could be pain, clicking, popping, noises in the joints, and muscle discomfort. And so many times we see patients who come into our office and ask us, how they can get some relief, and we help them with that, whether it's non-surgical or sometimes even surgical procedures to alleviate that discomfort.
Thank you. And before we sign off today, can you tell our listeners how to get a hold of you guys?
Yeah, the easiest way to get a hold of us is on our website at oralsurgerytexas.com. It's just spelled out, oralsurgerytexas.com. It has our phone number, our addresses, a little bit about us, a couple of cheesy pictures, and some videos too.
Well, I just want to thank both of you for volunteering your time. I know you guys are busy oral surgeons. Dr. Unver, Dr. Vickers, it's been great sitting down with you guys and talking about dental issues, which are very important for our listeners. And for our listeners, continue to listen to our shows this year on our various platforms. Again, we're on Facebook, Twitter, Instagram, YouTube, as well as on our website, doctalklive.com. And then for those who like to hear podcasts, we're on your favorite platform. So continue to show your support. Just again, thank you both of you for being on the show. I had a great time. I learned a lot. And to our listeners, we will see you next week. And until then, stay healthy.
Thank you.